pelvic limb, right? So we have scapula, humerus, right? Okay. Radius, ulna. Then we have our carpal joint, metacarpals, phalanges. Okay. How many phalanges are in digits 2 through 5? 3. Okay. So P1,
I'm sorry.
3. Okay.
So it's like proximal, middle, distal things.
In digit 1, we only have P1 and P3. Remember? So the rest of them are going to have 3 phalanges per digit, except for digit 1. Okay? Pelvic limb. We have our pelvis. Humerus. Femur.
You would have slapped one.
I know. Tibia. Fibula. Okay. Where's the fibula? Lateral aspect of the leg. And we have our tarsus, metatarsals, phalanges. Okay. And there's usually no metatarsal one, right?
Okay.
No usual dew claw, except for my dog has a dew claw. Then we have our rib cage, right? We have our sternum. What's the first vertebrae?
Mandibular.
Manubrium.
Some of them.
Okay. And our last one?
Xiphoid.
Xiphoid. Okay. What are these?
Floating.
Floating ribs. What is this one? False rib. Asternal. Why?
Because it's attached to the other one.
Correct. It's just connected to the cartilage of the previous rib, not actually the sternum. Okay. And then the true ribs. Okay.
Okay.
Skull. Everybody's cool with that. So if I pinned this, and this, what skeleton am I talking about? Axial. Okay. If I pin these, if I pinned this, appendicular. Okay. Pelvis is part of the appendicular.
This is what again?
Axial. So axial is the skull, spinal column, rib cage, and sternum, and the hyoid. Okay. All right. So on some of the bones, what structures are we interested in? So what is this one? The spine of the scapula. Okay. Then we have our glenoid cavity. So that's the concave region that is articulating to make the shoulder joint with the head of the humerus. Right? Head of humerus articulates with the glenoid cavity of the scapula to form the ball and socket joint. Right? What is this called? Greater tubercle, which is the point of the shoulder, right? We palpated it on Rommel. Okay. We go down the humerus. Then we have our
Epicondyles.
So we have our condyles, and then our epicondyles are just little nubbins off of the condyles. Okay. So our condyles are the important parts that's going to be articulating with the ulna and radius. Okay. So on our ulna, what's this called? Olecranon process. That's the point of the elbow. Okay. If I get an ulna out, we'll go over the anconeal process. So then we have our radius. So that's the head of the radius. So the head of the radius, the anconeal process of the ulna, and the condyles of the humerus are making up the elbow joint. Right. Then we come down, and we have our... I'm sorry?
Styloid.
So the styloid process of the ulna, so it's basically the point. And then we have our articulating surface on the distal aspect of the radius. And both of those are going to articulate with the proximal row of carpal bones. So the proximal row of carpal bones are named how? So the first row is named, right? Makes sense because it's the radial carpal bone, right? Ulnar carpal bone, accessory carpal bone. So the dingle is the accessory, right? Radial is going to be under the radius. Ulnar is going to be under the ulna bone. And in horses, right, we have that intermediate carpal bone in between. Okay. Second row, distal row of carpal bones, numbered 1 through 4, medial to lateral. Okay. Then we have our metacarpal bones. In our dogs and our cats, we have 5 of them, numbered, again, 1 through 5, medial to lateral. So if I pin this one and I say, what metacarpal bone is this? 3. Okay. The horse is made up of how many metacarpal bones? 1. And it is Number 3.
So your middle finger. So
Yes.
that's like on the ground like this, and then
Yes.
like 1, 2, 3.
Yes.
And then
Okay.
these are 2 of the
In a cat,
splints.
what's important about the nail?
Connected to
Part
the
of the
bone.
digit.
It's part of the distal phalanx, so it's part of P3. So when we declaw a cat, it's not really declawing, we're actually amputating. Okay, we're amputating P3. Okay? Then we have our pelvis. Okay? We have our humerus. So we have our humeral head. Our femoral head. I'm so sorry. So we have our femur. Good job. Our femur and our femoral head is articulating with the acetabulum, right? The pelvis. And then we have our condyles, again, down at the bottom, that are going to articulate with the condyles of the tibia. Okay? So condyles of the femur articulate with condyles of the tibia. We have our trochlear notch, or trochlear ridge, okay, in the distal end of the femur. That's where the patella sits. So the stifle, the knee joint, is made up of the patella sitting in the ridge or the groove, trochlear notch, trochlear ridge, I don't care what you say, of the femur. And the condyles of the femur and the tibia are all part of the stifle joint. Okay? Fibula is not articulating in the joint. Okay?
It's just whatever.
Fibula is just there.
Epicondyles.
Again, so the epicondyles, I'm not going to probably test you on epicondyles, but it's these little nubbins on top of the condyle.
Condyles are the big, the epis are the smaller.
Okay? So I'm not going to say, what is that? I'm going to,
Okay.
Then we have our, okay, so tibia on the lateral side, the little knob. Lateral malleolus. On the fibula, right? So I'm sorry, medial malleolus. See, snow. And then we have our fibula on our lateral side, so the knob is going to be the lateral malleolus. Okay? So tibia, medial malleolus, fibula, lateral malleolus. Okay? Then we have our tarsus. Okay, so the big bone, calcaneus. Okay, so the bone is the calcaneus, the projection is the calcanean tuberosity. Okay? Then we have, you can't really see them, so obviously you won't get tested on it, but it's the talus, right?
It's not even in the book.
No?
Not in mine, at least.
Tibial tarsal bone, sorry.
Tibial tarsal.
Tibial tarsal bone, so that's the talus, okay?
Okay.
And then we have the fibular tarsal bone. So again, just like in the front lib, it's going to be the one under the bones, right? So the radial carpal bone was under the radius, the ulnar carpal bone was under the ulna. So same principle. The tibial carpal bone is going to be under the tibia, the fibular carpal bone will be under the fibula, okay? Then we have
Is that an accessory?
accessory carpal bone. Then we have that second row, or second or third row, I guess you could say, because remember, the block vertebrae is taking up actually 2 rows. Do you have that?
It might be.
I think my notes have better pictures for you on those. But yeah, so it's 2 rows, but theoretically 3, because we have this block vertebrae that's taking up 2 rows. So everybody can clearly see the first row, right? Mm-hmm. And then see second row, third row. Okay?
Where's the trophy?
I'm sorry? So the trochlea is the groove.
Oh, okay.
So you can't see it, but that's what...
And that's the same thing as that's called there?
Exactly.
Okay, because I was like, there's 2 of them.
Yep. Yep. So it's the same thing that it's sitting in.
Okay.
But the bone itself. So it's the calcaneus is the big one, right? The trochlear ridge is on the talus.
Okay.
And then we have that central tarsal bone. It's that one. And then we have our block vertebra. I'm sorry. We have our block tarsal bone, right? And which one would this be if we number them 1 through 4 and we go medial or lateral? Which one would this be?
4.
4. Okay. Okay, so if I pinned that one, we would know that's 4. And then we have 2, 3, and maybe 1's there, but I can't forcibly say 1, right? 2, 3, 4, maybe 1. Okay, so calcaneus, talus, central. 1, 2, 3, 4. Okay. Then we have our metatarsals, 2, 3, 4, 5, and our phalanges, 2, 3, 4, 5. Okay. P1, P2, P3, nail, ungual process. Okay.
P2, P3, okay. But
So
all
P1,
just-
P2, P3, now. And this is a dog. So if we had a cat, P3 and the ungle process are combined. Okay? Dogs can avulse their nails, right? Everybody's seen that nasty little quick hanging out. Yeah, gross. Okay?
Right.
The skull is a lot, so I would have to use the lecture with this because this has got too much for me even to do. So if you want to do this, we got to go over there.